that breaking news in Texas, where Republican Governor Greg Abbott just issued an executive order ending the statewide mask mandate and will now allow all businesses to reopen at 100% capacity on March 10th. That is 1 week from tomorrow. Texas is now the largest state in the nation to no longer have a mask mandate. Joining me now is Dr. Kamara Jones, a family physician, epidemiologist, and past president of the American Public Health Association. Dr. Jones, great to have you with us. So what do you make of Governor Abbott's decision here? What could the fallout be when you see a state as large as Texas with numbers that have not necessarily declined to the degree that it would allow for someone to feel comfortable in opening up 100% and removing a mask mandate, now making this decision?
Well, his decision is premature, and it may cost many, many lives. We have to understand that this virus has one job, which is to reproduce itself. And it will reproduce itself, it will spread and infect and potentially kill any available, susceptible person. We control the availability of people by hiding from the virus behind our masks, by not mingling in crowds, keeping our distance. And then we can affect the susceptibility with the vaccine, which is having a very slow rollout. So, to take the only method that we can all employ, the masking and the physical distancing and the like, and to take that away at the state level and I guess leave it up to individuals, do they feel brave enough, is very premature. It's going to cause another spike in Texas, which will not just be kept in Texas, because what happens in Texas happens around the United States. What happens in the world happens in the United States. We cannot wall ourselves off.
Yeah, and certainly given I was going to say, and certainly just to add to that, given that there is no travel restrictions in and out of Texas, people who are affected by it there could certainly still travel, as you mentioned, and spreading it elsewhere. Let me switch gears and talk to you about the announcement, that deal between Merck and Johnson & Johnson. Pretty significant on that front. What are the biggest benefits you expect to see from such an unusual partnership, especially when it comes to vaccine access?
So I think that increasing the supply is very important because the supply is limiting our vaccination levels right now. But it is not necessarily true that increased supply will increase access to all populations, because access is limited by structures and systems and planning and that kind of thing. So we need to be intentional and make sure that vaccine is getting, I would say, first to those communities that are most impacted. If you think about the vaccine as a bulletproof vest, and the bullets are flying, right, and you have a limited number of bulletproof vests, you need to make sure that those who are most in the line of fire get the vaccine first. And it's actually been the opposite in our country so far, where the Black and Indigenous and other people of color populations who have been pushed to the front lines in terms of jobs with little protection are getting more infected, they're dying more, and yet are being vaccinated at levels lower than our percents in the population, not even meeting those percents, much less the percents who are affected.
Let me, before I let you go, Doctor, just go back to that Texas news for a moment. Talk to us about how it could have an impact on the country at large, this decision by Greg Abbott to abandon a mask mandate.
Well, first of all, politicians, it might give other politicians cover to act prematurely in the same way. And that would be devastating. It's almost like, you've been carrying this umbrella in the rain, and you say like, oh, I don't need an umbrella anymore because I'm dry. But no, even as the numbers are going down, first of all, the numbers of people who are dying, the numbers of infections are going down, but they're still above the highest levels that we had in the summer across the country. And then you don't close the umbrella when the threat has not gone away. It is still raining. There is a pandemic. This is a real thing. And we need to use all of the tools we have in our toolbox. We in this country have not ever used our public health strategies as effectively as we should have. And now to abandon them entirely with a little bit of vaccine optimism, it is wrong, and it's going to be deadly.
All right, Dr. Kamara Jones, thank you so much for your insights this hour. Greatly appreciate it.